University Science Malaysia.
A very good morning. I've been to all the judges, doctors, and all my friends who are present here. My name is Fu Yu Wei and I'm from USM. My research topic is retrospective study of oral squamous cell carcinoma with post-operative adjuvant therapy and associated factors at Hospital University Science Malaysia. Oral squamous cell carcinoma, OSCC, is a malignant tumor which is able to grow anywhere in the oral cavity. And in Asian countries, it is the most common subsite among different types of head and neck cancer. My general objective is to study the relationship between OSCC with post-operative adjuvant therapy and associated factors at Hospital University Science Malaysia from year 2011 until 2022. And my specific objective with the setting at Hospital USM are first to determine the proportion of OSCC patients among all the oral cancers, second to determine the type of post-operative adjuvant therapy for OSCC patients, third, to determine the factors associated with post-operative adjuvant therapy indication for OSCC patients, and lastly, to elucidate the factors causing OSCC patients indicated but not receiving the post-operative adjuvant therapy. My study is a retrospective cross-sectional study conducted from 23rd of October 2022 to 25th of April 2024 at Hospital USM. And these are my inclusion and exclusion criteria. My sample size is 75 and my study used purposive sampling, data collection form and SPSS version 27 for my study. And for objective 1, 2 and 4 I used descriptive analysis, and for objective 3 I used specimen correlation. This is the methodology, the study flowchart of my study. And let's move on to the result part. Table 1 shows the proportion of OSCC patients among all the oral cancers at Hospital USM. And our study found that from year 2011 until 2022, there has been an increasing trend of the proportion, and with the most in the year 2020. And the finding is actually coincide with the finding by Mosseri et al. In 2022 in the global setting. Table 2 shows the type of post-operative adjuvant therapy for SCC patients. For HUSM, we use radiotherapy the most. However, Cooper et al. In 2004 and Relis et al. In 2021 actually shows that chemoradiotherapy have more benefits than radiotherapy itself alone. Objective 3 shows the demographic and associated factors with the post-operative adjuvant therapy indication, and these are the factors that I used. TNM staging, margin status, and the comorbidity of myocardial infarct are actually correlated to the indication in our study. And let's talk about it one by one. TNM staging has a strong positive correlation with the indication of post-operative adjuvant therapy. And this is supported by the statement by National Cancer Institute in 2021. And margin status has a moderate positive correlation with the indication. And it is supported by the study by Yanamoto et al. In 2020. And lastly, myocardial infarct has a weak negative correlation with the indication. Priscillo et al. In 2002 stated that myocardial infarct was found to one of the most important prognostic comorbidities related to the OSCC. And table 3 shows the factors causing patients indicated but not receiving post-operative adjuvant therapy. And our study found that old age, great distance to hospital, and reasons not recorded or stated in the records are the factors causing the patients not indicated. And our objective 4 is actually supported by Chen et al. In 2014. And our finding actually reflects the importance of complete medical records, not only in Hospital USM, but in all the medical centers in Malaysia. And in conclusion, there has been an increasing trend of OSCC patients not only in Kelantan, but in the global setting. Therefore, our study highlights the significance of early detection and efficient strategies for the management of OSCC patients. A great thanks to School of Data Sciences USM, my research supervisor Dr. Tang Lizard, and my co-supervisor, Associate Prof. Technologist Dr. Wan Muhammad Amir Muhammad, and the SSC 2024 committee. Okay. These are my references, and that's all from me. Thank you.
Can you show the slide regarding staging and post-surgery RT?
Is it this one?
Yeah.
Okay.
Yeah. What is the finding in your center? How
Oh.
many stage 1 and 2 had RT and advanced had RT? Do you have that figure?
Doctor, we don't study about which stage has a better correlation, but we study in the whole whether TNM staging has correlation with indication or not. Yeah.
Okay, so what is new in your study? Now we know that standard post-surgery is RT for OSCC, right? So is there anything new knowledge that we
Okay.
should highlight?
Actually, factors affecting the indications. Yeah, it has been guidelines or protocols about it, but I believe that, and my supervisor also believe that different institutional or different medical centers actually has their own preference or own treatment protocols. It depends on the historical outcomes or the patient populations or even the institutional expertise. And also, it depends really on the patient suitability. For example, I need to assess the patient-specific factors such as the overall health, the TNM staging, and the prognosis and so on to determine whether to give a radiotherapy or chemoradiotherapy. So we believe that although there are a lot of guidelines or protocols already made there, but it also needs to adapt to different kinds of medical centers because there are different kind of patient populations and different conditions.
Thank you for your next presentation. Can you explain why the proportion has increased so much from 5.9% you said in 2011 to 2022 you say it is 8%?
Okay. The increasing in prevalence has not been only in Malaysia or in Asian countries, but also in the global setting. And I would say that the spike in 2020, actually there is the start of our MCO. Actually, I would say it is not related to an MCO because USM is a tertiary center, hospital USM is a tertiary center, and all the referrals will come from all the primary hospitals or Ministry of Health hospital. So the case of it's just a coincidence that the cases spikes on 2020. And why there is an increasing in the trend, I would say that because of the lifestyle, we know the etiology of the oral cancers, especially OSCC. The main etiology is tobacco smoking as well as bit chewing and so on. And we know that various studies has shown that the prevalence of smoking and also vaping have been increasing year by year in Malaysia. And even in teenagers, the prevalence of vaping has been increasing, and that's the risk factor causing the OSCCs and spiking throughout these years.
But for over 9 years, it can go up from 5% to 86%.
One thing about in 2011, because go back to the medical records issue, because in HUSM we use a lot of paperwork instead of electronic device to record all the medical records of the patients, and some of the folders have been dihapuskan, and that's why some of the records couldn't be traced back to the 2011. Yeah.
Okay, just quickly, very short time. Good presentation. For those issues that you raised because of the issue of manual entries on that, it's always best then to take out the data. So for that, you should take it out because it does not represent the actual study. Okay. And next, your objective number 3, you said there is a negative correlation with weak association, right?
Yeah, with negative
What's the
correlation.
p-value? Remember the p-value?
It was in the slide, but due to the slide restriction, I take it off.
But you know, if it's a weak association, I'm suspecting the p-value is high. If the p-value is bigger than 0.05, even though there's a negative correlation,
Yes.
it should be labeled as no correlation whatsoever. Right?
According to the study by
No,
the-
you have to follow your study. Because you're working your study.
Okay.
It's okay if the other study is not the same. Probably there is some issues like that which you can discuss further.
Alright.
So probably can see that. Alright, but it's good data. Yeah, you have excellent data.
Okay, thank you, Doctor. Thank you very much.
Thank you, judges and presenters. Participants, we will take a short 5-minute break to refresh and recharge before we continue.